Today we're taking a look at youth mental health and the complex conversations families and medical professionals are having around gender-related distress. Joining us now is Dr. Saleeby to explain more. Thank you so much for being here with us.
I'm glad to. It's an important topic.
Definitely. So when we talk about young people experiencing gender-related distress or confusion, what are some of the mental health factors you think families should understand?
So gender dysphoria is the kind of medical term, and it is really a psychiatric term. It has been heavily politicized by certain groups out there with certain agendas, and to take away from, the true meaning or the true diagnosis, if you will. So it can be very damaging with increased rates of suicide. There's been several studies going as far back as 2011.
Yeah.
A big Canadian study came out this year showing about a 19-fold, that's 19 times the rate of suicide in people that go through gender-affirming surgery.
Wow.
Yeah.
Wow.
So it was published in a urological journal that they're anywhere from 12% increase to 20-fold increase. That is a substantial, significant increase in mental health issues, suicide. The other side will say, well, there have been published papers and reports saying that if the person is not allowed to have that sort of surgery, that there's an increased rate of suicide. And I think that's false. I think that's a big lie to try to push that agenda. I think what happens is the focus goes to hormone therapy and surgery to change one's sexual appearance, whereas the issue of addressing the root cause, which is psychiatric, is kind of missed. So that's the danger there.
And what would appropriate support look like for someone who is going through something like this?
Well, just as if you have a schizophrenic who believes that they're like the king of the world, you don't tell them that that's okay to believe that. That's what we've always been taught in psychiatry. You help them realize with medication or with counseling or psychotherapy that vision of that delusion of themselves as being king of the world is not true. But you don't enhance it.
So it's important to look at existing conditions like anxiety, depression, social pressure in these cases.
Right. Now there's a book called DMS or DMSR Revised Edition. I think it's in its 5th iteration. That's basically the book for psychiatrists and psychologists to make diagnoses. And if you look at its influence, it's not just influenced by science, it's influenced by politics. Because back in the early 70s, I think it was 1973, the diagnosis of homosexuality, which was considered a mental illness, was changed.
Gotcha.
Not for science, but for political reasons, and then stricken from it in 1993. So that, amongst other psychiatric illnesses, you have to kind of look at why that's changed and how it's viewed.
Now, what should parents or guardians do if their child is struggling?
So important to recognize that it is a mental health issue and to avoid suicide under either way, by not doing anything or by doing something.
Because that's probably the biggest fear for a parent is, what, do I do something? Do I not, know?
So, getting counseling there are a lot of psychologists and psychiatrists that deal with this. I think that's before running over to your gender-affirming surgeon for surgical procedures or using hormone therapy, which can change the body and also the mind and how it thinks, is to seek counseling with an evaluation by a psychologist or psychiatrist.
Gotcha. How do you think social media is impacting this issue?
Oh, in a big way. In a big way, because it's very divisive topic. It can hurt relationships between kids and their parents, but also, there are laws now that are coming into effect that will prevent that from happening with minors, not allowing their parents to understand what's going on. So that was sort of pushed, that a minor, let's say a 14-year-old, could go in and ask for the surgery without having their parents be aware, which is not right. So that's been changed in many states, and some of the hospitals are realizing that that's probably not the best way to do it and are banning those kind of surgeries in their hospital systems.
Gotcha. And for people who do, go through the surgery or do the hormone therapy, are there any long-term effects that, we've seen research on when it comes to that impact their body?
Well, certainly those kind of surgeries can be very disfiguring. Hormone therapy, while it may change the outward appearance, with hair growth or with certain genitalia enhancements, it does have an effect on the brain.
Yeah.
And it can change their personality, can change the way they think, maybe even cause some forms of psychosis. So one has to be very careful with that kind of therapy.
No. Well, thank you so much for talking about this very important topic.
Glad to be here.
Thank you. We'll be back right after this.